Well, that's a really interesting question about case-based learning, because what happened is I was teaching third-year medical students in OBGYN, and I had two medical students who, at the end of the rotation, they came to me and they said, "Dr. Toy, we don't really feel like we're learning what you want us to learn." And I didn't really understand what they meant by that. So when I talked with them further, they said they knew that I was trying to teach them at a certain level and they just didn't know how to get there. So then over the last, about a year after that, then I just started trying to figure out different ways to teach. And actually these two students helped me, and I tried so many different curriculums and different ways of teaching, problem-based learning, team-based learning, and I finally said there's nothing out there that I can use. So I developed my own cases, and I used that for my students, and they loved it. And it taught them not only how to do well on tests, which they really liked, but also it taught them how to think clinically. And that's the hard part, is getting them to think about the mechanisms. How do you really think about disease? So that's how I got started, is that these students presented to me the problem, which is how to get them to a certain level, and then clinical cases was the perfect solution to that. So really interestingly, when I use the cases, the clinical cases that I developed, I was doing it mainly so that way the students could learn how to approach diseases and how to think about mechanisms, et cetera. But the result of that is that the students actually did much better on their standardized exams, national board exams, and my students, which were 6 or 8 students of the whole cohort, scored like 1 standard deviation above the rest of the students and versus the rest of the country. So actually we published that, and then that was accepted in publication and won first prize at one of the national education meetings. So that's one way that we knew that the outcomes were very good. The second way is because different faculty and the students themselves would say, Dr. Toy, we learn about the case that you taught us this morning, and we applied it later on during the day. And you know what? We could follow exactly what the different residents and the faculty were doing, and we understood what was happening. In fact, we anticipated it. So to me, case-based learning is so important because it teaches deeper learning and understanding and better care of patients, but also doing better on the multiple choice exams. Well, the case files collection is just simply all of the clinical cases that I developed, and with lots of other people, of course, but it's really using the teaching method that I found after a year of trying to search for the right method, and it's exactly the way that I have found to be ideal in teaching. So the case files collection allows both the students and the faculty to get over 1,000 cases, and they are built in terms of not only the case themselves, but also the reasons why you would manage patients in a certain way. So it gives students an idea of, if you were a seasoned clinician, how would you think about the diseases? And also it gives the faculty member, and especially the basic scientists, a glimpse of what would happen on the clinical level. But it also integrates all of that within the key concepts that we normally don't think about as a physician. So it gives us the biochemistry, anatomy, and other things. And I think it really tries to package it in a way that is time efficient, because for everybody, time is an issue. At the end, we also have multiple choice questions because it's important for students to test themselves. Did I really learn the concepts that are needed? So I think that the case files collection in particular gives access to so many cases in all the various areas. So I think that would be, something that really would be valuable for everybody.